83% of the Ethiopian population lives in the rural area. The paradox is 90% of the hospitals in Ethiopia are in the urban areas. Many of this population, they don't have access to modern health services. Per capita health expenditure in Ethiopia is very low, and service delivery is underfinanced. Drugs are not available. Supplies are not available. This compromises the quality of service at that level.
The overall understanding of people was there is no health care in health facilities, so there is no motivation to go to the health facilities.
Healthcare financing is designed to address these long-standing structural issues and to put in place sustainable health financing system that will ensure the availability of quality services and also at the same time ensure equitable health service in Ethiopia.
This healthcare reform has been critical in complementing and make the facilities work and then improve their capacity.
The reform started with the development of healthcare financing strategy, which was developed by the Ministry of Health with technical support from USAID.
So it's a 5-year program which started in August 2008 and ended in July 2013. This project implements 2 important programs, healthcare financing and health insurance. The healthcare financing reform component consists of revenue retention and utilization, fee waiver and exemption system. The private wing.
The primary purpose was to increase availability of resources, so it has both quality, equity, and access combined together.
Yirgalem Hospital is a big hospital serving a population of 4.2 million.
Shashamane Referral Hospital serves about 2 million population.
The major problem of health facilities is shortage of finance. Revenue retention and utilization. This is the discretion given to health facilities to retain the user fees collects from the clients and reinvest that for quality improvement.
Previously, they have to report back to the finance unit, and then they have to ask again. So it's not only inefficient, it's also ineffective. There is a back and forth, and they will not get that money on time. That means they will not buy the required inputs, so they will not give services.
The budget allocated by the government from the Regional Health Bureau is not enough to carry all the activities in the hospital. From this shortage of budget, there is no available drugs in the hospital, there is no available medical equipment in the hospital, and there is no required or needed manpower in the hospital.
In 2006, we began revenue retention and utilization.
With this reform implementation, this project is building capacity. We advise them where to utilize revenue they collect from clients.
We have trained the health facility staff how to report, how to record, and then how to properly manage their finance.
The hospital should now have a strong finance section. They have to plan in a good way to allocate this internal revenue in which the whole activities of the hospital improved.
More than 90%, I can say, of health facilities in Ethiopia, more than 100 hospitals, more than 2,000 health centers are retaining and using the revenue and managed by decentralized bodies. This is a breakthrough in Ethiopian health delivery system.
the revenue in some of the hospitals, in some of health centers, they have now even a triple budget than previously. At the same time, the utilization rate is also improved.
We used this revenue retained in the hospital to improve the quality of the service in the hospital. The availability of the drug in the hospital improved. We construct the new OR, cafeteria, a new medical record room. We buy medical equipment like microscopes. We don't have pathology in the hospital, but hiring specialists by this internal revenue, we have pathologists. We don't have surgeon in the hospital. On the contractual base, we hire the surgeon in the hospital.
Overall, I can say it was very successful because they have improved their health facilities. The access and the quality has improved.
ተኝቻስ ጎንብሶ ሲሰደይ ዝም ብዬ ተቤት ተጎንብሼ አውጥቼ ገንዘብ መታከም ማለት እንዴው ምንም የለኝም እንዴውም ትንሽ ለእጅ ወዳፍ ለማለት በሰው ወረት እየሰራሁኝ አሁን ያን ብር መመለሻ አጥቼ ተቀምጫለሁ እንኳን አውጥቼ አጥፍቼ መታከም ያልታከም አመት ሰታም ይሄን መንግስት ላከኝ
Few-ever system is one of the major components to address equity in this country. Nearly 1.5 million population are selected and getting few-ever service in the region.
Few-ever is the right given to an individual or a family to maximize health services in public health facilities without any payments.
የነጻ ታካሚ አገልግሎት አሰጣጡ አገልግሎቱ ይሰጣል ከዚህ በፊትም ይሰጣል አሁንም ይሰጣል አገልግሎቱ አሰጣጡ ሁኔታ የሚለይባቸው የተለያዩ ዋና ነጥቦች አሉ
The old system the poor used to go to the social court so they need to have 3 witnesses so that they can witness that they are poor and unable to pay for health services.
To measure poverty is very difficult and complex. So what we have decided is let the community will identify who is the poorest of the poor because community members are better judges to identify who is the real poor. For instance, those vulnerable children who do not have mothers and fathers. All people who do not have any assistance.
የሆነ ወንድም መጣና ይዞኝ ሄደና ተቀበሌ ይሄን አስወጣልኝ የላትም እነሱ ይባል የላትም ምስኪን ናት ያው ተወጣልኝ ጀምሮ ሕክምና በደም ተሳክቶ እየታከሙ
አልመጣም እንጂ ያው ሲጨነቅ ነው ይዘው የሚመጡ እንጂ ራሴን ወገቤን ምናምን ሲያመኝ አልመጣም ጠቀመኝ እንጂ ወባና ታይፉድንም አዳነኝ ይሄው ኩላሊትንም አስታግሰልኛል
At the beginning of the year community will identify those poor households and those poor households will be granted this free access once they are chosen by the ward administration.
ያሁኑ ጥቅሙ ምንድነው አንድ በሽተኞች አንድ ጊዜ ያችን መታወቂያ ከያዙ ፍርሸንጎ ምናምን ይሄ ደብዳቤ ማጻፍ እንደዚህ አያስፈልጋቸው
Once they have this certificate or identification card they can go to the facilities at any time of the year so this smoothes the provision of health service for the poor people.
ጠቀመኝ እንጂ ምንድነው ያልጠቀመኝ በነጣ መድኃኒት ሲሰጡኝ እኔ በጎስ ሆን ስድን ይታወቀኛል እንጂ እርዳታው እንዴት አይታወቀኝ
ራስ ደስታ ዳምጤ ሆስፒታል በአሁኑ ሰዓት 320 የሚሆኑ ሰራተኞች አሉ። ወደ 180 የሚሆኑ
የግል ሕክምና ከመከፈቱ በፊት አብዛኛው ሐኪሞች ወደ ግል ስለሚሄዱ መንግስት ውስጥ የመቆየት እድል የለም። በዚህ ሆስፒታል ውስጥ ጄነራል ፕራክቲሽነር ያስፈልገን የነበረው 11 13 የነበረበት ዘመን ከ2 እና ከ3 አይበልጡም ነበር።
In Ethiopia, the major problem of health professionals is attrition. Private wing is an establishment in public health facilities allowed to work as private business so that workers in the health facility practice during off-working hours and holidays.
It has two objectives. One, to retain the high-skilled health professionals. And the second objective is to create additional value, additional opportunity for clients who doesn't have adequate time and who has the capacity to pay additional fees in the private rooms.
በፕራይቬት ዊንጉ ቀላል ገንዘብ አይደለም የተሰበሰበ ያለው። ራሱ ለሆስፒታሉ 15% የሆስፒታሉ ነው። እሱ ራሱ ቀላል አይደለም። በዛ እየተሟላ ያለው የሕክምና ዕቃ መሳሪያም ቀላል አይደለም። በአጠቃላይ
Currently, there are 31 hospitals with private wings in the country. So this is very promising. Workers of the health facilities are earning more revenue, and they are also given more discretion to work in the public hospitals. So they don't have any reason to leave the public health facility.
አብዛኛው እንደውም አሁን እየተጣሉ ነው። ራስ ደስታ ካልመደባችኝ አልሄድም የሚሉም ሰዎች አሉ፣ እያሉም የሚመጡ አሉ። ቤቱን ስለወደዱ ሳይሆን በነፊቱ ስለተገኘ።
With this reform implementation, highly qualified health professionals earn 61% of their income from private wings. This is a very astonishing result, by the way. So private wings are playing a very important role in motivating highly qualified health professionals and retaining health professionals in public hospitals.
The utilization rate at the hospitals where the private wings are being opened has increased significantly. We have observed significant change in many of the hospitals because of this quality improvement.
እና ትልቅ አስተዋጽኦ ነው ያደረገው ለድጋፍ ሰጪውም ሰራተኛ፣ ለባህል ጤና ባለሙያውም፣ ለሆስፒታሉ ጭምር ነው አገልግሎት እየሰጠ ያለውና በጣም በረክተዋል።
Every individual has the right to maximize health services. This is a human right. The ultimate outcome of any health system is to improve the health status of people.
Healthcare financing, together with other health reform initiatives, is trying to bring an opportunity for citizens of Ethiopia to have access to modern and quality health services.
Community satisfaction because of the quality improvement is increasing. So overall, this is improving the attitude of people to go to health facilities, to seek health services, and it's improving the overall health sector performance and improving the health status of Ethiopians.
It is really amazing that visualization has increased, and then the community's involvement is so encouraging. Now we are considering the scale up, and the region are very much keen to move into the scale up.
It's giving a lot of hope to all of us who are involved in the process, and also more than that, to all Ethiopians who are benefiting from the various reforms going on in the country.
The most important element in this project is the government ownership. Though USAID is supporting financially and technically to this project, it's already owned by the facilities.